So I'm here with Dr. Phillip Blair, who's become a good friend of mine over the last couple months, and we're just here to sit down and talk about a few of the things we've been working on over the last month or so. And so I really appreciate you coming to Colorado. And I guess the first thing I'd really like to speak about is maybe you could tell people about what we did, how we went. We gave a presentation together talking about liposomal hemp and how you use it in your practice.
That was a great presentation that we gave, and it was a huge impact to this particular group, who were a collection of chiropractors and physicians that were using some advanced forms of therapy for their orthopedic type of patients, those who have had injuries. And they were getting great results with what they were doing, but they wanted to go to the next level. And I think us going there and talking about cannabidiol really brought it to that next level. And it was exciting to bring it, and we could see the enthusiasm in that crowd. It was thrilling.
Yeah, you could really see the gears turning, right? And people started noticing these gaps that they had in their practice, and how, adding this hemp nutrition, into their practice really was going to help them out and maybe get some results that they didn't see before.
Well, I think your message about this being a whole plant substance and what it could do as an overall benefit, and I brought in the medical and the clinical side and experience that I've had of how it covers so many of the other things that are involved, as well as providing the analgesia and the anti-inflammation that needs to be there. But a real surprise was actually with regard to stem cells. And maybe we'll talk about that. But your point about the whole plant substance was really strong.
Yeah, I mean, it's one of those things, right? So if you're going to give somebody a food, you want to give them everything, right? I mean, you're not going to take just the green out of lettuce, right? You're not just going to take just, the red out tomato. You want the whole plant, the whole material. I mean, the actives definitely have their part, but if you really want to feed somebody's endocannabinoid system, you really want to give them everything. And, in a little bit, we're going to go to the farm and really see how these plants grow. We can certify again that they're organic. These are natural Colorado hemp plants found here naturally that we just, not we, but the farmer, our partner in this, really helped, grow and just help nature out.
I want to corroborate what you just said about the whole plant substance, because I've seen this clinically. And what I've looked at is people coming to me who have used isolate type of CBD, and the performance is just not there. And there have been a number of studies that have really emphasized that point, where you have a linear and a continuing improvement as you increase the doses of CBD. But when you use the isolate, you reach a bell-shaped curve where you get a maximum effect, and then it tapers off. You don't get those benefits. And in fact, several studies have been released recently, and they're showing that same exact fact.
So, everybody's heard me talk about liposomes and all that kind of stuff. And the reason I'm going to try and segue into that is because we talked about the study, and this study was using hundreds of milligrams, grams of material, right? I mean, that's really expensive, but you showed some data where you were effectively microdosing, right? And for everybody out there who doesn't know what microdosing is, it's when you give a very small amount of any substance and you see what the effect is.
You're exactly right. I saw a tremendous response from just using a few milligrams, 5 milligrams typically, for patients with post-traumatic stress disorder who had not been successful using all of the other therapies involved, or had the condition for 10 years or more. And introducing the liposomes to them in microdosing, it typically was 5 pumps or 5 milligrams twice a day. Dramatic response. Right there in front of me, Emek, I saw these people relax their face, their eyes open up wider, and they would smile to me and feel the calm and relaxation that they hadn't felt for years.